Hello everyone. Today, we're delving into the world of a medication called Olux, commonly known by its generic name, clobetasol propionate. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Olux, or clobetasol propionate, is a topical corticosteroid medication available in various forms, including creams, ointments, foams, and solutions. It is primarily prescribed to treat various skin conditions characterized by inflammation and itching. Clobetasol propionate belongs to the class of drugs known as high-potency corticosteroids and is known for its anti-inflammatory and immunosuppressive properties. It is used to alleviate symptoms associated with conditions such as psoriasis, eczema, dermatitis, and certain other skin disorders. Warnings: Before using Olux, it's important to be aware of certain precautions and contraindications. These medications should not be used on the face, groin, or underarms unless directed by your healthcare provider, as these areas are more sensitive and can be prone to adverse effects. Olux should also be used with caution on thin or fragile skin, as well as on children and infants, as their skin may absorb more medication and be more susceptible to side effects. Before using this topical corticosteroid, inform your healthcare provider if you are allergic to clobetasol propionate or any other corticosteroids. Additionally, share any history of skin infections, circulation problems, or immune system disorders with your doctor. It's crucial to discuss if you are pregnant, planning to become pregnant, or breastfeeding, as the safety of Olux in these situations should be evaluated by a healthcare professional. Side effects: Like all medications, Olux can have side effects, although they may not affect everyone. Common side effects may include burning, stinging, itching, or redness at the application site. These side effects are generally mild and should improve as your skin adjusts to the medication. However, if they persist or worsen, it's important to consult your healthcare provider. Less common, but more severe side effects may include skin thinning, stretch marks, or changes in skin color. Prolonged use of high-potency corticosteroids like Olux, especially on large areas of the body, can increase the risk of these side effects. If you experience any unusual skin changes or symptoms, notify your doctor promptly. It's also crucial to be aware of the potential for allergic reactions, such as rash, itching, swelling, severe dizziness, or trouble breathing. If you notice any of these symptoms, seek immediate medical attention. Interactions: Olux is primarily applied topically to the skin, which reduces the likelihood of significant drug interactions. However, it's still important to inform your healthcare provider about all medications, including over-the-counter products, herbal supplements, and topical creams or ointments that you are using. This information will help ensure there are no potential interactions that could affect your treatment. Dosage: The correct application and dosage of Olux are essential for its effectiveness and safety. Always follow your doctor's instructions on how to use this medication, as they may vary depending on the form of Olux prescribed, cream, ointment, foam, or solution, and the specific skin condition being treated. Typically, Olux should be applied sparingly to the affected area of the skin, and it's important to avoid excessive use or prolonged application unless directed by your healthcare provider. Wash your hands thoroughly after applying Olux unless your hands are the treated area. Always adhere to the prescribed frequency and duration of use. Avoid: While using Olux, it's advisable to avoid applying the medication to areas of the skin not recommended by your doctor, as well as to avoid getting it in your eyes, nose, or mouth. If accidental contact occurs, rinse the affected area with plenty of water. FAQ: Many individuals wonder about the duration of Olux treatment. The length of treatment can vary depending on the specific skin condition being addressed and your individual response to the medication. It's essential to follow your doctor's guidance regarding the duration of Olux use and any tapering instructions, especially if you have been using it on a long-term basis. Closing: That concludes our overview of Olux, or clobetasol propionate. Remember, this information is intended for educational purposes and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns related to this medication. Thank you for tuning in.